Hi, everybody. Greetings. Welcome back to Einstein's Eyes, our YouTube channel. My partner in crime, Jon Ditkoff, a cornea specialist, and myself, an oculoplastic specialist in Anchorage, Alaska. John's in New Jersey. We both trained at Albert Einstein College of Medicine, Montefiore Medical Center way back. I don't even want to admit it, but Jon and I are seasoned ophthalmologists. Today, we're going to talk about an oculoplastic procedure called the lower lid blepharoplasty. This is a common procedure. It's done through I do it through the inferior conjunctiva. I pull the lid down, I make an incision, and basically I remove some fat. You have to watch out for a muscle called the inferior oblique. You don't want to injure that to cause double vision. You want to avoid bleeding products because a hemorrhage can cause vision problems. So essentially that's it in a nutshell. It takes about 25 minutes. Usually you're asleep. It's called LMA. It's a light anesthesia, but you are asleep at a surgery center. And you go home, you put cool compresses on. You look bruised, swollen for about 2 weeks. And you really, though, get rid of that swollen, puffy look that people don't like. And I'm going to show you how we actually do that. So this is a diagram view of how this surgery is performed. And you pull down the lower eyelid. Here's something called the conjunctiva in the fornix, the lower lid fornix. The nose is here. Here's the medial or inside part of the eye. Here's the outside. This is where the ear is. You make an incision. This is called the orbital septum. You open it up and you see the fat. The yellow product here, the yellow object is the fat. You remove it very carefully and very judiciously, and you cauterize. This is a cautery. You cauterize so you don't get bleeding. You do not want to miss any bleeders because that will cause a problem with hemorrhage, and you could get this thing called the compartment syndrome where you can lose eyesight. So you want to be very careful when you do this. You also don't want to take too much fat. You don't want a hollow look like you've just been, a POW or something like that. You want a pleasant look that people won't really be aware that you've had a procedure done. That's the key. You want to look like you've been on vacation. Right, Jon?
Yes, I never look like that.
So, and then you put a couple stitches in here. Some people don't, and you close it up.
So Carl, I have some questions for you.
Go ahead, Jon.
So number one, so what's the indication to do this? I mean, who do you think should have it?
The indications would be someone who's unhappy with the way they look. They feel that friends always ask, why are you tired? I would say those types of things. Very rarely, people with Graves' disease can have excessive fullness due to the disease, the immune activity that necessitates removing and getting rid of that pressure that's in the orbit. Sometimes even people will have so much fat prolapse that it'll push on their glasses and cause the glasses not to sit properly on their face. But I would say in my practice as an oculoplastic surgeon, primarily it's folks that just want to look better. They want to feel better about themselves, and that's valid.
So yeah, then I have some patients that have had this done and they're very critical. I mean, like, what's the success rate? I mean, can you get it to that? Like you mentioned, you don't want it to be too flat, and you also don't want it to look unrealistic. And then you want it to look symmetric. I guess both sides should look the same. I mean, are the odds pretty high when someone has this done that you're going to achieve that?
Yeah, so
Okay.
that's a great point. You want to set expectations appropriately from the beginning. You don't want to talk about it after. You want to do it before. You want to make sure everybody's on board. You want to talk about what you can do, what can happen, what you can expect, and what you can't do, and what you shouldn't expect. That's the key. I say it can make a difference. Absolutely. I've had happy patients. Really, some of my happiest patients are the lower lid blep patients.
Yeah, I agree. I had a friend recently that had it done. He's very happy.
Right. But
what's the youngest patients? I mean, I have some patients right now, just genetically, they're in their 20s and 30s. They just genetically have very, very full lower lids. Can you do it in someone like that?
Yeah, you can, but again, you have to be super careful, and you really got to talk about, you know, what's going to happen down the road, because if you gain a lot of weight, the fat can come back, and there's got to be a level of maturity to give you consent.
Yeah.
Yeah. So that's what I look for. But I will tell people to wait if I don't think they're actually ready for it, or if I don't think I can make a difference.
Oh, that's great. I really,
So this is a before and after image of what you can expect after a lower lid transconjunctival blepharoplasty. You see the lateral fat pad, the medial fat pad. Now, in between here, something called the inferior oblique muscle. You don't want to injure that. You want to be aware of that. And that's why you would see somebody who's familiar with the anatomy and with the territory. That's why an oculoplastic specialist would be appropriate and smart. And then here afterwards, you can see how much flatter it is, how much smoother. And this is a great outcome. This is what I would strive for. The surgeon here did a great job. But there's a couple things you should be aware of. I don't like tightening skin. I don't like removing skin. That's why I go through the fornix and I go through the transconjunctival approach. I find that you can cause retraction and pulling down, a cicatrization or pulling down, a scarring of the lower lid. That's really, really not admirable, or not what you want. That can cause problem with closure of the eyes and dryness, tearing, things to that effect. So I'm a conservative guy, and it's worked well for me. And that's my approach. John, anything to add?
why does her nose look so much better?
She might have had a nose job too.
Yeah, I mean, I'm definitely concentrating on the lid. Her lids look great. That's really a great result.
Those are the type of expectations that one should have. I think we just wanted to make a simple, straightforward and short video about lower lid transconjunctival blepharoplasty. John, any further comments?
Yeah, I would just say, I mean, I'm a general ophthalmologist. I specialize in cornea, but in my early years, I did a lot of eyelid surgery, hundreds of cases. And there's a reason why I have an oculoplastic specialist in my office now, and that's what Carl does. I think there's no question the training that an oculoplastic specialist receives is far superior to what I received. Also, the experience and the fact that they're doing significant volume. So you really want to seek somebody that is going to give you a realistic expectation, but also has the experience to let you know where you might be disappointed, but also that you're in good hands.
Thank you, John. That was great, as usual. Pearls of wisdom. So guys, thank you for being here. Like and subscribe. This is Einstein's Eyes, our YouTube channel. John and I will see you on the next one. Bye.
Great.